Did you have it on that recorded?
You need to do it again, sorry.
Okay,
I'll make a motion to go back into regular session.
I'll second the motion.
a motion from Stager, a second from Derby, go back into open session.
Derby,
Aye.
Dunlop,
Aye.
Stenzer.
Aye.
Let the minutes reflect that we are now back in open session. The closed session has been concluded by agreement of the parties. No matters were discussed other than that the sale of the LEC and bids for which the closed session was taken. No votes were taken or any other action. There being no further discussion, is there a motion to end the closed session?
You already did that.
We already did that.
Since there's
All right.
so many here, I'd like to move number 6 up and get it out of the way.
Unless you want to get rid of Scott.
Get Scott out of here.
Scott's being paid no matter what.
Oh, all right.
They wouldn't give you
I-
that. Oh, no, you don't totally believe it.
He's going away. All right. Number 6, discuss funding of public health.
So I put this on the agenda because I went to the public health meeting, the board meeting the other day, and listened to their plight and came up with some numbers just from the numbers I have through all my years on the board. Did you give one to her? Ruth? Oh, there you are. This is what I came up with so far. I know there's a lot more to extract out of the information, but so you can see how their budget, I didn't have the actual budgeted expenses for 9 and 10, but all the others are in there, I believe. And, you know, every year the demand has gone up, and as far as the transfer from general basic, that's been sporadic when needed. So the change we made this year, but to not fund it, but wasn't unusual. I mean, there's been many years that we have not budgeted or needed it. So I guess you can see how this year's, the 2018 budget, the revenue was less than the expenses. And that includes a $50,000 transfer in the budget. So one of my questions I have for Carla is, in 2017, it shows a possibility of a $125,000 transfer. Now that never happened last year, right? Or
That did.
Oh,
It did happen. That did happen. It was the year before that it did not happen.
Okay.
And the year before that, it did not happen.
I showed a transfer in 2015 on my paperwork.
Oh, that one, the 180, the 181, yes, that one did. The 214 did not.
Okay, so my question.
What was that number?
That was
you know?
the 214, 399.
339 did not get transferred.
That one over.
I know, but was there any that got transferred?
None.
None.
None in 16, and I did ask for it.
In that year, your expenditures exceeded your revenues by 50,000 or so, 52,000. So my question for Carla is that 214,399 that we did not transfer that year, we levied for that money, but what happened to the money? Is just go back into the general basic fund?
Stays in the general basic fund.
And the process, since we didn't budget enough for a transfer this year to cover the costs according to them, is there any way to draw off of that money that we accumulated that year?
Every dollar that we have this year is spoken for.
What's going to be our ending fund balance?
Pretty much nothing.
We've gone from 20 to 25% ending fund balance. It's going to be down to 0 this year.
How does it happen? Yeah.
Yeah, I'd like to know that.
Where did it go?
Public Safety Center, the maintenance on this building has turned into a
Last year,
unbelievable expense.
the last 2 years, the budget amendments have been over $500,000.
Yeah, but we've been running about $1.5 million on our ending fund balances.
Can you pull those numbers up at all?
We've been hitting almost 20% on our ending fund balances. And I'll just say this for the record, if we're in the shape we're in, it's time to clean house in 2018 and 2020. Man.
But you can see where the expenditures in public.
And I'm including myself in 2020, so.
2009, our expenditures were $635,000. And the last one I have is 2016 was almost twice that. But that's kind of a misnomer too, because we have much more demand, and Medicare cost reimbursement has changed. I'm looking at 2015, we gave them the 181, and they showed 150,000 revenue more than expenditures. So that should have carried over to the next year.
But that includes that, correct? That
Right.
includes yeah.
So they had it in their account to carry over.
Right.
And that's probably why we didn't transfer in 2016.
Well, I'm going to ask for an audit. I'm going to ask for an audit of our county, a full-blown audit. We need to find out what's going on. And I do not have the expertise to do it. I don't think anybody in this room does. So,
So the audit would get done by Gardner Thompson.
Our audit happens every,
I'm asking for a full-blown audit, not just a random audit. I'm asking for it, and I know it's going to cost, but I think it's well worth the money. I'm asking for a full-blown audit. Guys in my district have been asking me to do this for years, and I've put them off. But I think it's time that we did it. Independent audit.
yes, yes.
So,
It's
that's
not an actionable
no,
audit
I know,
today, but
I know. Yeah.
So here's the annual report from 15-16. This is the ending fund balance.
Fiscal 16.
Yep. And then when you do $500,000 worth of budget amendments, I mean, that significantly lowers. I take the ending fund balance from 16 when I do the 18 budget. And then in between there, 17 had large amounts of budget amendments, which caused me to overestimate the beginning fund balance of 18. So that's part of the problem. Part of it is we've expended more money from the Public Safety Center than we ever thought we would. We've spent more money on this building project than we ever thought we would.
Well, I am going to try to find the money to. I think you're going to have to pare back services. Yeah,
There is
where you can.
Yeah, we will where we can.
I know that. But like I say, I want to find out where every dime's gone to. So until that happens, I don't know how we can, in good conscience, make a decision here. So.
Well, we discussed at our board meeting that the difference, taking out the overtime for the nurses, because that comp time was taken away long before I started. And the board is okay with that, but they wanted to see in writing a policy that I would follow for that, so we wouldn't end up in trouble with somebody accumulating a lot. And so we have a plan for that, Mike. We also, if we have to cut homemaker services to people that just get homemaker, if they're not getting personal cares, we won't do any of that. There's ways that we can cut back some without really hurting our clients, that need us for medical. And another thing we're looking at too is healthy families and where we can go with that, because that's an expensive, that draws on us too. So, and then on the other hand, we have a whole bunch of regulations that CMS has implemented that we have to follow, that will take up a lot of that money that we can save in other areas.
And I'm pretty sure we all understand that. I do, because I sit on the board. And so that, that's the discussion that's going to have to be had in January of how much, and I really hope the public takes an interest in this, because we're going to have to make some hard decisions when it comes to that. We just are.
I think the public is very interested, Mike, because we're getting multiple calls.
Oh, absolutely. I've gotten calls.
I'm sure you have.
Facebook's exploded with it.
Pardon?
I say Facebook has exploded with it. And
But I don't. You know what?
You've got a lot of people in this county that are getting older.
I'm not interested in Facebook posting, because
I'm
that can be done on.
No,
I've had
I'm just
personal
saying
calls.
that
No,
interest,
let me
just so
talk.
you know.
I've had personal calls that make a lot of sense, and I agree with them. We do need to take care of, quote, our elderly and those that need it. I got two people that are under my care that public health has done a fantastic job. Had they not done it, it would have been a huge expense to all of us, much more. So public health is invaluable, in my opinion, from a personal standpoint.
May I speak?
Sure.
I do a lot of volunteering, and I deliver meals on a regular basis, and so I witness the needs of these people and the services that our public health does for these people. It is, you can't even put a price on it. It's so valuable. And these people are able to keep their independence. Because what are these people going to do? It's just terrifying. I'm really worried for them.
Well, we can either spend $1,500 maybe. I'm just throwing this out now, so I can't be quoted on this, I hope. We're spending $1,500 on a person that, if we didn't take care of, would cost $6,000 to $7,000 in a nursing home.
Yes,
Exactly.
right.
So-
Well,
Yeah.
but the reality of that situation is there's no $6,000 to take care of that person
No.
in a nursing home.
No.
They're not going to go to a nursing home.
Yeah.
These
No.
people are going to die prematurely in their own homes.
Right.
So
And we have
this
to
is a
have
discussion
conscience
that we
about
should have
that.
come January, okay? We need to figure out how to get through the year.
So
Okay,
what
financially.
can we do as citizens to help with this?
Well, unfortunately, you have to put numbers on everything,
I realize that.
and get out and convince everybody that they're going to be happy about paying more taxes, I guess, is about the only solution to this right now.
Exactly.
But I can't imagine that people wouldn't be okay with it, especially to take
Personally,
care
I
of
wouldn't
elderly.
be. I mean, the public health did wonders for my mother, my
Oh,
dad taking care of my
absolutely.
mom.
Yes, Nancy
Yeah.
needed it.
I have no angst to make this problem. I mean, I had never had any intention of this problem happening. I guarantee you that.
But another thing that is going to happen too is if there's not public health support to keep people in their own homes. And what are the doctors going to do at the clinics when they have a patient that they're not taking their meds right and they're having some medical problems? Who are they going to call to go in and assess the home situation for them? And that's going to be a long-term, but that's going to be a long-term consequence. We're not going to be able to get doctors and nurses and PAs and nurse practitioners to man our clinics if we, as a community of people, are not willing to take care of those that are the most vulnerable. And everybody's going to suffer from that.
And this is the discussion we have to have in January at budget time when we throw the money in to public health, okay? Because it's a very important discussion, very important.
Well,
And
I mean, it even goes beyond us here. I mean, this whole MCO thing has created a large percentage of this problem. And they patterned it off of Kansas's thing.
Yeah,
And now
look at where
Kansas is
Kansas
running
is
away
now.
from it as fast as they can.
Right.
And yet we seem to be still going, you know, charging ahead with it. I can't understand it.
So is this something we need to change at the state level?
I would think so.
Absolutely.
I mean, it's
Absolutely.
how
And then
you
the
ever think
federal-
you're going to send your money to someone else and have them give you 60 or 70% of it back to take care of your problems? I never have understood the math on that. You should just take care of ourselves. But
Yeah. Well, for
I guess if to solve what we're here for today, I would hope that we could find the money to get through this fiscal year. Okay? I'm asking you guys to do house cleaning.
And
I
other
think there'd be
departments too.
Yes.
Other departments too, not just public health.
Oh, no, yeah,
Every
no,
county
this-
department needs to take responsibility for
Yep.
this.
I have a question. We had that issue at the end of the fiscal year where we hadn't got the money for that federal grant for the public safety center. And then we're getting that at some point.
That passed, so yes,
We,
privy on that one.
I've been trying to get a form from John Hanson for the architect. The architect has to sign something. That's the last thing that needs to go to, for that.
So that money comes in, is it all spoken for?
Yes.
Okay. We've been
Are you talking about the WCTA thing?
yeah.
That has to go to the.
It's all spoken
Yeah.
for.
Well, I mean, it's
Yeah,
you
that's-
built the building and
Unless
it's
there was a
spoken
way
for.
around the barn.
But it just seemed like we were borrowing from Peter to pay Paul to get
We
everything
have-
paid as we went.
We have the general basic has that money out of it because the public safety center fund is in the hole, that $360,000. So that has to be moved back from the general basic to go into that fund once that money comes in.
So we paid bills with what money now?
The general basic
Okay.
until that $360,000 came in.
That's what I'm wondering. When that 360 comes in, does it go back to general basic?
It'll go into the public safety center fund to make it a zero
It'll
balance.
pay back what we spent on general for.
Right.
Yeah.
And it'll make it everything zero.
But we
Did
could,
we have in our revenues for this year that 360,000? In our projected revenues, was that 360,000 in there?
I don't know.
because once you put it back into the public safety center, you would think that the money that you gave to it to cover expenses would come back out then, wouldn't it?
I remembered when we did budgeting, we had counted on that money in the last fiscal year. We weren't planning on revenues there. That's where I'm wondering if we can possibly draw some money off of that, if it's possible.
That money is all spoken for.
I don't think you're understanding. It's spoken for, but whatever has been spent out of the general fund will be paid back to the general fund.
Right.
Yeah, right. Yeah. But yes, in essence, it is spoken for. But I guess from a fiscal standpoint, we're just going to do the best we can.
I called
It should never have come to this. And I'm part of the problem. I'm sorry. Diane?
I have a question. When you do an internal audit, who performs that audit like you usually do? You're asking for a special audit outside?
I'm asking for a full-blown audit,
When they
which
do
will be
the
on next
outside one,
week's
who
agenda.
oversees that?
Pardon?
Who oversees the ones that have usually been done in the past?
Gardner Thompson is the ones that's been doing our audits, and they're accredited for them. They are, but they just do a random audit. I would like a full-blown audit of our
Well, it would
county.
be interesting to see, you know, yes, we've had a lot of extra expenses. What departments and who are they in, and where and how much and how much?
You see, when it
money are
comes
they
to
putting
accounting,
in?
I mean, especially forensic accounting, like I say, I don't think that Adam included. I don't think anybody of us could sit down and look at our budget and see where there's possibly something gone awry.
So
Maybe Adam could, but I know I couldn't.
So if you ask for an outside audit, how does that proceed?
I'm going to have to look into that. Oh, yeah, I'm going to have to look into that. But, yeah.
Thanks.
And it's something that should have been done. It should be done every 10 years, in my opinion, but it doesn't. I don't think it's ever been done in this county, but it should be done.
And if you're going to do that, are you going to do it in a multiple of years? Are you going to put parameters of how many years?
I don't care if it's ever done again, but from I'm
Mike,
responsible right
Mike,
now.
I think you need to put on the agenda for next.
Oh, okay. All
I think
right.
you're just.
Yeah, we can't talk about this. I'm sorry. It's not on the agenda. Yeah.
Okay.
Good point.
The one thing I will say is, had we been aware in March that you made that change, we could have had this conversation a long time ago and maybe tried to do things a little differently already in this year time frame that we're already through.
Well, there's where I'll admonish you. If you could have done things differently, cheaper, then you should have been doing it already. Okay. So,
But
I know you don't want to hear that,
Well,
especially from one of your board members, but you know.
But that could be said about everybody that works. for the
Exactly.
county, too.
Exactly.
Right.
Exactly.
Yeah.
Yeah.
And if I wasn't told back in 16 that I didn't need that 214, we wouldn't be sitting here either.
Exactly.
And I had said that earlier,
and she had asked for
and
it,
I had asked for it several
and it
times,
was not given.
and it was not given because I saw what was coming down
Yep.
with the MCOs.
Yep.
And it was in our budget approved.
Yes.
And that was when Jane was here, so I didn't really have an inkling about that.
Okay.
But if we would have had that money then, we wouldn't be sitting where we are now.
Can you explain to me how the MCOs have changed the reimbursement process, just so I have it clear in my mind?
Biggest would be percentages.
Yep, it's the
Biggest would
percentage.
be percentages.
The percentage and what they deem medically necessary for us to go out and see a patient. So you have to have a pre-authorization.
Socialized medicine.
And if they do not believe with their formula they have,
Which is based on acute care.
acute
Yeah.
care is medically necessary, you do not go out. Or no, that's
You can go out,
you
but
can
you
go
won't get
out, but
paid.
you don't get paid.
Right.
The stipulation with that is, if they deny you to not go out, and these people need to be seen, you cannot charge those people.
And the mental health patients have cost us a lot more nursing time, a lot more work. You know, when everybody was in Duncan Heights being taken care of in a group home, which they don't want anymore. I mean, that was cost effective versus what we're doing today.
It's 3 times as expensive.
Yeah.
Exactly.
And I can't understand it at all. I really.
We don't really.
And I honestly, I don't. It changes all the time because I don't think they understand.
We got sold a bill of goods by our previous administration at the state.
Exactly.
Right.
And I don't mind saying it.
Exactly.
I still cannot understand what he
And
thought we as
The
a
people
state
that are
had to
hurting
do.
are the people that need us,
Exactly.
and they don't look at it that way.
And it angers me.
And it's got to be by design.
And the moral dilemma here is that if they don't go out and see those mental health patients, even though they're not going to get paid for it, their mental health care is going to occur in the sheriff's jail.
Right.
Or in every jail here. And Iowa has practically gone to that already, that our mental health system is in the prison system.
At a cost of probably
At a
300 to
huge-
400%.
At a huge
So what
cost.
happens, it's just a
Yeah.
trickle down effect.
Yeah.
You know, if we don't go out and see those people to get their medication, then you're going to have John Doe running around Forest City creating havoc, which in turn sends our police department to arrest them, which ends up being in, you know, it's
Unfortunately,
this.
that's probably the cheapest way to handle it.
It's a vicious cycle.
We've got one guy that cost the CSS region, at one time he was costing $1,000 a day.
Well, we sit by, and when I say we, I'm talking myself. I'm on the board of Cherokee. That's a 1,500 bed unit down there in Cherokee. There's between 100 and 150 people down there in a 1,500 bed unit. What do you think it cost per person in that unit per year? $300,000. And I don't sit and raise Cain about it. So, I mean, you know, and I should be. So I'm admonishing myself too. Let's just end this, I think.
Well, I want to know, is that pretty
Now let me
much the
finish, Terry,
extent of-
please.
Okay.
No.
Let's just end this. We got to come up with a solution right here for the finance fiscally, okay? Because that's what we're here about, right? Okay.
My original question to her was not, I don't think, finished. We kind of got off.
Right.
Okay. I'm sorry.
So I forgot where I was at, sorry.
So I asked about the MCLs, how they affected the process, and how things have changed in your budget. You know, it's doubled in just what
Right.
8 years or whatever.
Yep.
Oh.
We have more clients.
Okay.
I mean, way more from when I started.
It's more time consuming.
Time consuming.
Well, and that's another issue
Exactly.
I have, is you guys spend as much time doing paperwork as you
Exactly.
do seeing
And
patients. So
phone.
that
And
doubles
phone.
our expense right there.
Exactly.
I used to sit behind her when she's talking to these people, and 1 month they will take all of the information that she sends to them and they will pay public health what they owe them, and then the next month she will give them the exact same information, the exact same coding, and they will not pay it. And then she spends hours on the phone.
That's what happens when you give someone else your money and then expect them to get
Yep.
it. My grandma Ethel years ago said, anytime you give someone else, it put them in charge of spending someone else's money, I guarantee you'll have irresponsible spending. Well, I mean, this is kind of the same thing where you just can't expect to give it to someone else and not want them to keep it. I mean,
And with that, I only get a year. I mean, so let's say I see you a year ago. I only have 1 year from that time I see you for that billing to get things straightened out. And they like to drag their feet because when that year goes up, we're in trouble.
They don't do
Well, they don't have to
And
pay.
the other thing is they want you to give up.
That's exactly right.
They want you to give
And
up.
I'm the type of person who likes to fight for every dime because I think they need it. We need
Okay.
it.
What do you think you're going to need? Because we need to start working on this.
I don't even have a number, Mike, to tell you what I need.
Okay.
Because with the new rules and regulations coming down from CMS, I can't put it. I don't know. I don't know.
So far, we've transferred 30 out of the 50,000
Yep.
we budgeted.
Yep. And I just gave Julie a deposit. I'm doing the best I can. I mean,
Didn't we do the 50?
no, you only did 30.
Yeah.
Yep, you only did 30.
It should
I
have
thought
been 50.
we approved the 50.
You approved it, but you only did 30 right now.
Oh, it should have been. Well,
Well, that's
I'll make
what
sure. I will double check.
But
because it should
I
have been
mean,
50.
if I get my billing done, which I have been doing, it all depends on the charting also.
Yeah.
If I can get it done by the 15th, hopefully in 10 days I get paid. But then there's sometimes that they don't pay me in the 10 days. So,
Because right now you're running on a really
oh
tight
yes,
budget.
yes.
That's not
And this month
cash
I
flow.
had to pay for a flu vaccine.
That was huge.
And that was huge because the vaccine price went up. So, I mean, it's
There isn't anyone in this room that doesn't want to resolve this problem. So, I mean, we never intended to get here. It's just,
We gotta find out how we got here. Yep.
Alright, well, thank you.
I will try and come up with a number to let you know. We just have to look at.
see what we have to do with this.
Thank you, we
right.
appreciate that.
Yeah.
Thank
We
you all,
appreciate
thank
that
you
There's
all.
such a dire need here.
No, you didn't bring anything.
Oh,
Just me.
Please put that on next week's agenda to talk about a full-blown audit, please.
Maybe. Don't bug him again. Nope, I don't.
Scott.
Transferred 50,000.
They did?
Yes.
Okay. That's my bad then. I thought it was 30.
No, I have it right here.
I know we approved the 50.
It's right here.
I
Right
wonder how
there.
she only got 30.
50 expenditure, 50,000, right there.
Alright.
This thing is not running today.
Yeah.
Is she still out there?
Who you look for?
Julie.
Julie!
That's what it's not saying, 'cause it's not in
You're
there.
in. Right, it's like I'm not getting real. It's like I'm not running for real.
We did transfer 50,000.
Okay. What you did?
Yeah.
Okay.
Because that's what we approved, so it should have been.
Right. Well, I just didn't know because at
I thought it
the
was
Board of
30.
Health you said 30, and I thought,
That's
well,
the number that
that'll
stuck in my head from the things that went by us there. And
right. So it was 50. Okay.
yeah. My bad.
Okay.
Thank you.
Thank you.
Alright, Scott Minders, engineer, will discuss secondary road matters.
Sorry I put you in the back burner.
That's all right. That's all right. Well, I can find things to do. Got a group of people out there waiting, so I understand. Anyway, we got our bridge projects for the year complete, so except for some maybe touch-up work and seeding, things like that, but under control. So that's nice to have all those things under wraps. We still have a crew working on edge road repairs. I believe they're south of Buffalo Center and moving to south of Thompson soon. And then our bridge crew will do a little bit of ditch cleaning and then move to some culvert under the road and separations and tile repair stuff to try to get some things fixed up before winter. That's about it.
You guys got anything?
I have nothing.
Okay, then we will go to number 4, consider for approval utility accommodation permit for Heartland Power.
Okay, I have 2 utility permits from Heartland Power, and these are essentially the same project. However, one location was on the county line, so both counties are going to approve that. So, same one project, 2 permits. I'll have you approve. There are several locations through the county where the ITC transmission line will be going, and Heartland Power is undergrounding their crossings just to stay out of the way. So, several locations. Very minor amount of work, overhead to underground. I checked the tile maps to make sure of any place they're going to be crossing, so they're deep enough or out of the way, or we'll expose them beforehand. Other than that, I don't have any real concerns, so they'll be getting started shortly if they get approval. And we'll probably have some more locations after this yet as they work across the county. This goes to about midway through the county, north of Thompson.
I'd like to make a motion, if it's legal, to just give Scott the approval to approve these Heartland permits, so it doesn't have to keep in and get brought up. Is that
For
possible?
the same project, you mean? For this
Same
project?
He said there's going to be a bunch of them.
In
Yeah.
conjunction with the ITC.
As long as Scott's okay. I mean, if Scott's comfortable with it. I don't know if he wants individual approval.
Well, then I'll make that a motion to give Scott the approval to just to approve these permits.
Because usually we won't approve them unless he approves of them.
Right.
So,
Now, are we doing this for all permits, or are we doing
No,
this
for
the
Heartland Power.
for the
The ITC,
ITC
yep.
in conjunction with the ITC project?
with this specific project. That sounds fun to me.
Okay, I'll second that motion.
Motion Stover, second Derby, to give Scott Miners, engineer, the authority to approve the ITC permits for Heartland Power. All in favor, say aye.
Aye. Is there a signature
So,
by us there?
Yep, but I can
So
sign
they-
my name and initial it as well.
Or you could just
Sign-
bring it to the meeting, we don't have to have it on the agenda, and he can just sign it.
Sign them or whatever.
Yeah, otherwise I can print your name, initial it, and write where the minutes are.
Okay.
That sounds good.
Okay.
Not rocket science.
Number 5, set public hearing date for road vacation of part of 355th Street in section 28 of Mount Valley.
Okay, I have some things for you.
I must have been daydreaming. Where is this?
I will show you.
Is this east
Okay.
of Leland, or?
Nope.
And it's 355th, so it's got to be one of them odd roads.
I'll give you a map here. All right. This is a location you probably haven't seen with your own eyes because it is off of improved roads. So northeast of Forest City, a resident on the west end would be Jesse Groves, and on the east end is a property that has not been habited for a while. This quarter mile that's shown in red there has not been an improved road ever. So the improved parts of the road come from the west and east and kind of dead end at the properties. So this quarter mile has the same owner on the north side as the south side, and they are working on some wetland restoration project. And the DNR has approached us about vacating this right-of-way for that project.
So now, in the winter, what snow removal guidelines do you go by previously on this road?
I'm not sure if they plow that one or not, since there hasn't been anybody living there, but
It's a level B right now.
I believe so. From the east it is, I believe. And
Well, this is a 216 plat book, and I show a residence at 21730, 21730 on the north side.
yeah, on the north side. Yeah. So at the end of this sort of improved roadway, it turns into their driveway and snakes into,
Oh, okay. All right.
snakes into
All
the
right.
acreage.
Okay.
Yeah.
All right.
So even this wouldn't isolate anybody
Okay.
from road access. Yeah, good question.
So we'll come in from the east to that point, then go back then.
Yeah, if there's somebody back there that would like that service, but if nobody's using it, I don't think that we would allow it.
Okay. I just want
That really wouldn't change based on this vacation, because you can't go through there anyway.
Yep. Yeah. Right. Is that road totally out of there? To the west?
There's a picture on the
The
second.
quarter mile that we're
Yeah.
talking about,
Yeah.
I would
You can't tell where.
maybe like field path status.
Okay.
So, the residence is on the east side?
Yeah.
North side of the road.
North side
North
of
side
the
of the
road.
road, right. It looks like there's can't quite make it out.
Address would be
Right
address would be
So there's a home
21730.
Oh, it's up in here.
Yep.
And then there's a home right here at the end of that. No, right there. See if it kind of pads on the yard.
Yeah.
That probably gives you a better. Yeah, the red X.
Okay. Yeah, we have fertilizer here. That's what I was thinking. That was the same place.
So today, by setting the date for the public hearing, we will mail notices to the Hansons, the owners on north and south side, and then we'll also put it in the paper, and at the public hearing, then anybody with objections can make their case.
What time frame are we gonna have on that then?
Well, what I have today is to set the public hearing for November 14th. So if I can have it in the paper by next Wednesday. That would give everybody about 2 weeks.
Would you say the 14th?
November 14th.
Public hearing for
Number 5.
number 5.
You wanna make that a motion?
Yes, that's fine.
Is a resolution.
Yep.
I'll second Mike's motion.
Motion from Stanger and a second from Derby to set the public hearing for road vacation for 355th Street in Section 28 of Mount Valley for November 14th at what time?
9:30, it
Nine-
said on there.
Oh, is it out here? At 9:30? All in favor, say aye.
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 Duplicate copies there. Did I just give you 2 sheets? Yeah. I think maybe I'll have you put that on the stack for Carla so she can sign those 2, keep one and give one back to me.
All right.
Yeah. I do have, if we could jump back to number 3, I do have one more thing.
Oh,
to
okay.
brief you on.
Back to secondary roads.
Sunnyside pit where we have a gravel pile and an open pit and use as a staging area. We talked about this before, how we lost our tenant for the upcoming year. Knowing what we know and with sort of uncertainties about what CRP will become, really no time frame of when we'll know more, I'd like to advertise it for public bid to find a tenant for that ground. What that takes is for us to similarly set a bid date next week, and then we'll have everybody submit bids by a certain day, and we'll open them here kind of like we do for construction projects for drainage. The way that I set it up, with your approval, is similar to what other counties have done. They submit a bid for the entire lease, a total amount, and that amount they're allowed to raise by $200, kind of like an auction, in the setting of the boardroom, so that what we end up with is the highest fair price that somebody is willing to enter into contract with. And then from that point, you would authorize me to approve the contract with them, and it would be the same lease any other farmer uses.
Is that a 1-year lease then?
I have written it as 3-year, and ongoing from there unless terminated. But
So you're setting a price for a 3-year lease, and then
be a price per year
per year.
for 3 years.
How
To
many
avoid,
acres?
I'm sorry, go ahead.
How many acres
It's about 45
that you're renting out?
that we would be renting out, and some of that isn't very productive, and you'll be able to see that by the air photo. The Thompsons have chosen to leave some of it uncropped this year, and maybe in past years too.
To avoid the hoopla of us getting involved in, not that we don't have to, but I'd like to give Scott just the authority to take care of this matter.
Can you do that?
I don't know why we can't.
I'd like to have you guys approve a bid date.
Oh, you do? Okay, all right, that's fine.
Other than that'll be a simple motion next week.
Okay, all right.
All right. Get it on the agenda. Anything else for secondary roads? Move on to auditor's office. We'll discuss Drainage matters.
Chris in the office?
No, she's gone today. She didn't have anything.
All right.
Well, that's okay.
She's at the last meeting.
All right. Then we'll go to number 8, open forum. Anybody? Anything exciting?
Anything in the pile over there?
Any manure stuff? Look like it. Maybe it's a little thicker than that.
That's from last week.
Yeah, I already did that. All right. And we stand adjourned. Alrighty.
And that who made the motion?
There's no-
That public hearing one?
Oh, Mike.
I
You
said,
did?
Now
Okay.
should go to the paper.
okay, about the
Something
road.
that you would like.
Yeah.
Yeah.
Shoot on. Give me an email, I would appreciate it.
Yeah, shut off
Question, you said all the bridge projects were complete.
What's that?
Yesterday, we received a notice from
We stand
Winnebago
adjourned.
Road
Yes.
about the Leland
That
Bridge.
maybe wasn't perfectly clear. So all of the bridge projects that our crews are doing for the summer are complete. Bridge projects that